There's so much to be said about that, Josh. So the impact to the community is one thing. And I see this being as it's different in the fact that it's not just your infrastructure that you need to worry about, but it's people's lives. So if you get caught, with the ransomware or downtime, can we dig into that a little bit? Like the considerations that go into this decision that's different for healthcare, even taking into account their ecosystem of other emergency services, right? So can we dig into that a little bit?
Sure. So from a technical standpoint, if you get hit with ransomware, the one of the most impactful things to the organization is the interruption of system functionality. It's systems not being able to access the data they need, not being able to function and operate, and allowing people to deliver the service that they need to deliver, which in terms of the healthcare side of things is much different than a business. A business might have financial downtime and impact where, you're not able to sell your products or this or that. But in a medical institution like a hospital, you're dealing with life preservation. You're dealing with actual potential impact to human life, which is a much different sort of flavor of pressure. It's much more intense. It's a lot more damaging in terms of impact, potential lawsuits and other things that might come out of it down the line. So it's much more impactful when a healthcare institution gets hit. I know there's a lot of solutions out there that they use today to optimize care, like tracking medications and patient information and things like that. And if suddenly you're having to revert from a digital system to your paper backup copies, which based on your processes and procedures and your response protocols might be organized, might be there, might be available, might be difficult to get that stuff turned around in time, you could not only have an impact where the life preservation, responsibility of your organization isn't able to be fulfilled as quickly as it needs to, and you could lose patients, but also you just won't be able to deliver the level of service and care that you need to your patients who may not be as life-threatening. And so in general, the impact to not just the organization, but the customers and the patients tends to be a lot larger.
Just to put a little bit more context around the question, because I think that's a great question. Also, in a sense of risk management, just the overall risk management discipline, right? When you think of managing risk and mitigating risk, you always want to know what's the likelihood of the risk, right? What is the impact of that risk, and then what is the mitigating action or mitigating steps that you can take to reduce or fully mitigate that particular risk. And of course, in our profession, we talk about technical controls, financial controls, cyber insurance, a number of other things that you can bring together to optimize your ability to manage that risk. Well, in healthcare, that gets a little bit more complicated because of the point that Josh raised, right? Because the impact becomes more than just a dollar figure, or becomes sort of an infinite dollar figure. And it sort of changes the stakes. While on the other hand, the likelihood and the complexity or the barrier of entry to expose a vulnerability or exploit a certain vulnerability or exploit some sort of control is relatively low. So that ROI of an impact or creating a massive impact for healthcare organization in the eyes of the bad guys is much greater than anywhere else. And I think that makes the situation so much more difficult for healthcare, not just large, sort of access to anything and everything type of organizations, but especially rural healthcare organizations that don't have the same access to resources when they're dealing with that sort of a misbalance of a gain that a threat actor can have versus what they can do in terms of resources to prevent it.